Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, welcome back to Insurance Matchmaking. I've got Elijah in with me this morning to keep me straight.
Good morning.
Yeah, but actually, it's kind of funny. I talked a little bit last week about AI taking over our business and replacing us, and I said, I don't think that's a big issue. And every week when I don't have, an actual guest, it's like, oh, I get the show tomorrow. What am I going to talk about? And I just keep racking my brain. And I find out, wait a minute, I got this AI stuff. and the thing is, there's a process. One of the things that I think I've mentioned on here, but is, and maybe you are listening to this on YouTube. I get the recording. The radio station provides me the recording. They put it in Dropbox for me. So I take that in Dropbox and I put that audio into one AI tool that gives me a transcript of the show. And then I take that transcript and put it in ChatGPT and say, hey, give me a summary of this for my YouTube with some hashtags and give it a title. And I've been doing that now, and I've gone back. I think I still have some I haven't done it to yet, but I've gone back and did it on a lot of my old shows and updated what was on YouTube, because once I take that info and I send that to my webmaster, and then they create it as a YouTube and post it on my Insurance Matchmaking webpage, which I have a link to from my business page. They link back to each other. What a concept there, huh?
Yeah, AI is definitely a great tool to use, but it's not going to replace people anytime soon.
No, but the thing is, I basically now have a personal relationship with my AI. I can't remember what it was. It was a month or two ago. I did something, and it addressed me by name. And it's like, well, Matt, this is what you typically do, or something like that. And I'm going, okay, this is getting kind of weird. And I actually just watched a show this week where this kid was he's like autistic too, but he had his chat bot on his phone, and it was telling him things to do, and it wasn't necessarily the best advice. But anyway, I digress. But I realize it's like, I've done all these things. Chat kind of digs into their history. They know, and it knows what I've said before, because I've had it actually asked it to do things. It's like, hey, revamp this and put it, in my voice, because it was like something somebody else had done. And I really like, that it changed. Some of the changes I had to go back and change because there was some verbiage that I had to use, but it did change kind of the way I was presenting it. But I was like, hey, chat, I need some show ideas for something that I haven't covered or haven't covered in a long time. And so that's kind of where we are. So we're gonna kick it off with the one, and I used to say this, it's not so bad in the Medicare world now, but I used to use the hashtag Don't Call Joe. And if you can remember, it's actually been a couple of years now, they really cracked down on these misleading commercials. But you had these celebrity spokesmodels, and one of them was Joe Namath. And some of you listening may not be old enough to know who Joe Namath is. I can remember watching him play, but he was a quarterback for the New York Jets, won one of the early Super Bowls, and I think he was Alabama. I think, I didn't live in the SEC conference in those days. I lived up in the Northwest. I was in the Pac-8 as it was back then. And so I knew who Joe Namath was in the NFL, but I really didn't know who he was in college football.
We can all agree you like the SEC better, though, now, right?
Oh, yeah. The Pac is, heck, the Pac teams are in the ACC now.
Yeah.
It's like, yeah, right. Okay, so you can take a team from California, and they're in the Atlantic Coast Conference. I think they're on the Pacific Coast, but I digress there again. But my feeling is I'd like to see the NCAA just go ahead and make the regions be, actually regions.
Yeah.
That they would go ahead and just, and limit it to 8 or 10 teams, and you can have the two divisions within that, have a championship for that conference, and then those conference champions are the ones that go into the playoffs. And you might still have kind of a couple wild card teams of, either a non-aligned conference, or maybe that team that finished second in the conference, that was their only loss, was that conference championship. Yeah, they kind of deserve to be in there. So. And again, this is not a football talk show, but I got kind of went down that rabbit hole. But anyway, one of the things that chat mentioned, and I know I've talked about, like I said, don't call Joe, but the approach that the chat took to it was why calling the 800 number can cost you thousands. What do you think on that? What came across your mind when you read that, Elijah?
My mom.
Your mom? Okay.
Yeah. So last year she was on a plan. I don't think I can say the carrier's name.
Yeah, especially since you are talking about your mom. We got to be even if it's your mom, we got to be careful about HIPAA and so yeah, I try to avoid using company names because it can either sound like a condemnation or an endorsement. And right now, we're not trying to do either when it comes to specific carriers.
Well, so she realized at the end of the year that her specific plan was going away, and so she called the 1-800 number, and they tried to crosswalk her to a gold plan, and it was going to cost her thousands more than switching carriers. And so after she was so upset, nervous.
Yeah.
And I'm sure a lot of our listeners probably have felt that same way. How am I going to afford this?
And I've got that, just when I get done with somebody, I just think I did something very simple because as I said, yes, I know. I do this every day. It's, it seems very simple to me, but I have to remember, not to use the vernacular sometimes. Yeah. It's like what I talk about every day, the terms I use every day are like meaningless. I was on with a client yesterday and I said, I know, because we were just doing on phone and I was covering a lot of information. And I said, I know it. At some point, you were hearing Charlie Brown's Teacher. That's why yeah. So that's why I like, and we're getting together a little bit later. She's going on Medicare. She's not quite in that window yet to sign up. You've got like another month or so. I said we probably should do that as a Google Meet because she doesn't live local, so it's probably one of those that will. We do a lot over the phone and a lot over online, but
yeah.
So but go ahead. I'm sorry, I cut off your story.
Thinking back to November, just thinking about the look in her eyes, she was scared. She was nervous. She didn't know what to do because she thought that was the only option.
Right.
Thankfully, her son's an agent.
Yeah.
But based on that 800 number, call that she made, she thought that was her only option, and it was going to cost her thousands of dollars, and she was going to get a whole lot less coverage than she did the year before. So luckily, we were able to switch carriers that had I wouldn't say better plan, but a more affordable option, and then paired it with a hip and a cancer plan. And so she's getting all around better coverage for a much lesser price. And so the fear, the nervousness turned into happiness and joy and just thankfulness that she wasn't going to have to pay more money and get less coverage.
Right. That's like we talked about. I've talked about it here a couple times too. Is that plan? It's called TrioMed. I'm not using the carrier name, so you have to dig a little bit to come up with it. I don't mind. You can call us and we can tell you exactly who the carrier is. But But the plan's called TrioMed, and the thing I loved about the plan, and it made it very simple. They used to have two different kind of levels of their plan. They had their underwritten plans, and then they had their guaranteed issue. And just before the open enrollment time, they changed it to all the levels were guaranteed issue. So there's no health questions. It's not asking you if you smoke, if you had a heart attack. Now, there are pre-existing condition exclusions because they won't cover that pre-existing condition for the first 12 months. But after 12 months, it's like you never had it. But the one I loved, and again, I've talked about it on the show here, but what I loved about it was it's a combined accident and critical illness plan, and you pick the level of critical illness and accident coverage you like. Well, the one that I liked, because people have a tendency when you say, hey, this is the one I like, this is the one I think you should have, they're like, yeah, I agree with you, and they're not going to dig into the weeds of, well, why don't I get this one, why don't I get that one? Most of them were like a $5,000 accident level, and then you had different levels, and actually there was even a $2,500. I don't think I've written that one to anybody either, because the reason for getting this plan is to cover that deductible and max out of pocket on the plan that you have. And so what I did was they had a 10-10, and it was $10,000 for critical illness, and it's like and it's up to $10,000 for accident. And it's not going to be, oh, you broke your little finger, you went to the urgent care. They're not going to send you a check for $10,000, but they will cover your treatment, your expenses for that accident where you broke your finger. So if you had a heart attack, boom, they're going to pay you the $10,000. We switched a lot of people to bronze plans, and most of them, they're around $10,000. Some plans have $10,500 max out of pocket. And so that $10,000, you're protected against that maximum out of pocket. And speaking unlike on your mom, what was the difference in premium from now? She still end up going with a silver, but it was just a different carrier, or you went to bronze? Okay.
Yeah, she went from gold to bronze, and the premium difference was about $800 a month.
Now that was between the gold and the bronze.
Yeah.
What was the difference between what she had and going to that bronze she went to?
Oh, she was saving about $150 a month.
So saving about $150,
which she used $100 of it for the ancillary products, so she was getting better coverage than what she had on the gold plan.
Right. So there's $1,200, over $1,200 of savings right there. And like we said, don't call the 800 number. And I've always said on here too, deal with a local agent. It doesn't have to be me or Elijah. We hope that that's who you call, being local. But there are other agents here in town. I'm not going to disparage anybody. But I'd much rather you deal at least with somebody you can look in the face if you need to, and they're going to be familiar with this local market. There's plans right now, different carriers, and this is more in the Medicare side. But when we talk about the Advantage plans, some of Vanderbilt's not in network. Well, that's important to a lot of people here in Middle Tennessee. Mm-hmm. So that might not be the best plan. So that's where, we switch. East Tennessee, it's, hey, does UT hospital take it? So those are some of the thousands. What did you have any more? You mentioned, you said,
yeah, I've got another.
You did a hospital, and you did it. You said a hip and a cancer. So tell people what a HIP is, Elijah.
Hospital indemnity plan.
And what's indemnity? That's a big fancy word. What's that mean?
So what that means is it will reimburse you the money for when you go for your out-of-pocket expenses.
Right.
So you can use that money for whatever, whether that be paying that hospital payment or any out-of-pocket expenses you had in order to go, whether that be, you had to call an ambulance, you had to have an Uber driver, whatever it is, it pays you directly.
Right. And I picked on him there a little bit, but yeah, the indemnity, basically it's, I maybe I oversimplified it. An indemnity plan pays you.
Yeah.
I think, what was it? That was a thing I think we used to, that wasn't with Aflac, but it was like, health insurance pays your doctors in the hospitals. Who pays you?
Right. And
that's where these indemnity plans come in. And we can still save you thousands by having you get another policy, but the difference in premium between a bronze and a silver, especially now, and especially if you're a little bit older, people Elijah's age, it's not as big a deal. But also, most people your age are a lower income. You're still building your career. Whereas people, I want to say my age, but it's like they're younger than me now too. But those maybe those empty nesters, they're in their 50s, they're early 60s, they're not ready for Medicare yet. They've got good established careers, or their incomes are a little higher. So if they are getting a subsidy through the marketplace, it's sometimes not very much, or they make just enough that, hey, you make too much money, you don't get any help, and then it's not affordable. So we have alternatives there, but that's where it really can make a big difference. If you're in relatively good health, or even not the best of health, but you have to see the doctor a couple times a year, maybe every 3 or 6 months to get refills and things like that. A lot of these bronze plans, they have copays, or very low copays when you go to your primary doctor. But hey, if you have to have an MRI, or you get admitted in the hospital, those things you're going to have to hit a deductible. And even on a silver or a gold plan, you still have a deductible. And the amount of money that you're saving on one of those more higher level plans, you can get a bronze plan and then subsidize, like as Elijah said, with a hip and a cancer plan in case you do get cancer, that pays you a big lump sum, totally way more than covers your max out of pocket for a couple of years, and you didn't spend out an extra couple thousand on your health insurance, and you're better covered. And that's, I think, it's hard for people to think, well, I just want health insurance. It's like, yeah, paying $250 a month to have your copay $20 less that you might use twice in a year, that's not good use of your money.
Yeah, and with the additional savings, my mom, with the HIP plan, we were able to put several riders on there for diagnostics, major, minor.
All those things are good.
Outpatient surgery.
That go towards the deductible.
Yeah.
And so now you're paid for it. All right, well, we're up on the break, and we'll be right back.
Dreams are built one home at a time, and you can help make them real. Join Upper Cumberland Habitat for Humanity for the Putnam County Dream Builders Luncheon, March 24th at Live Church in Cookeville. Social hour starts at 11:30, lunch at noon. Tickets are just $25. Or become a table host for $400 and make an even bigger impact. Join the Dream Builders Luncheon and support affordable housing in our community. Reserve your seat now at uchabitat.org. For 75 years, Twin Lakes has been connecting the Upper Cumberland, from the very first landline phones to today's 100% fiber network. Now they're celebrating 75 years of keeping you connected. Join them at the end of March and throughout April at each of their Twin Lakes customer service offices for anniversary celebrations, featuring cookies, swag, and 75 chances to win a $100 gift card at each event. Find a full list of office celebration dates on their Facebook page. Twin Lakes, connecting the Upper Cumberland for more than 7 decades.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we are back with Insurance Matchmaking. As Elijah and I kind of discussed during the break, and I love to use the real life examples. He used his mother. He thought, hey, it's kind of a similar situation, but it was a Medicare situation with a gentleman I was working with. So go ahead, Elijah, and share that story.
Yeah, so another story. When you're calling a 1-800 number, he saw a commercial, he called it. The person who works at that 1-800 number works for that specific carrier. Mm-hmm. They're not a broker like your local agent. That's another reason why, Matt encouraged you, whether or not you choose us, choose somebody local, somebody who knows the plans in the area. Because this person that I was working with, in his area, that specific carrier didn't have the plan that he specifically needed. Mm-hmm. They gave him the best that they offered, but it wasn't in the client's best interest.
Right.
So he's getting a $75 a month give back on a chronic special needs plan when he should have been on a dual needs special needs plan, but they didn't offer that in that area. Mm-hmm. And so that plan would have given him $330 a month to go towards food, utilities, rent. And so he's missing out on $2,700 a year in benefits.
Right.
So it literally cost him thousands just by calling that 1-800 number.
Yeah, and we didn't, and I'm still getting familiarized with the chronic special needs plans. We've only had them in Tennessee for the last couple of years. And I say last couple of years, it could be 5 years, but it was, and they're still limited. They're not in every county, as we always talk about when you hear, what's your zip code? Your zip code helps us narrow in what county you live in to figure out what's the right plan for you. And he talked about the C-SNP, the chronic special needs. In some ways, they have some good benefits. I mean, and that plan does, that he mentioned, because it does have like a $75 a month, food card or whatever, because you have, but some of the co-pays, the max out-of-pocket aren't, and even the drug coverage is not a great savings over just a traditional HMO or PPO Advantage plan. So I'm a little disappointed, because I can remember looking at it before and go, I wish we had these plans in Tennessee, because there was ones that were designed just for diabetics. Well, one of the big things with the diabetes C-SNPs in the past were you could get a great reduction on your insulin cost, or your diabetes prescriptions. Well, now there's a $35 cap on insulin now, and that's one that kind of confuses people once in a while. And again, this is why you don't want to just call an 800 number, because they say, oh yeah, our plan's great. We've got $35 insulin. Did they make sure they double check to see that your insulin was on their formulary? Because some people can only take one kind of insulin. There's different brands. There's different kinds, and if you're diabetic, you know what I'm talking about. Whether it's Humulin, Humalog, Lantus, there's all these different names for the different insulins, and sometimes you're on one because the other didn't work for you. Well, if that's not on the formulary for that insurance carrier, that's not a $35 insulin. And when it comes to your Part D coverage, we do have that $2,100 maximum out of pocket for prescriptions. If your prescription's not on their formulary, you don't have a $2,100 max out of pocket because you're paying for that one yourself.
Absolutely.
I went through that with a couple this week. There was one, and it's an asthma inhaler, and I don't know what it is, and not the Part D, and I say the Part D plans, and when I say Part D plans, I'm also talking Medicare Advantage. They just don't like some of these inhalers. And the thing is, there's this other one. Oh, yeah, well, that one takes two. Well, I guess you could take that. No, I can't take that one. It doesn't work. So now they have to try to get a formulary exception. And their doctor's going to have to write a letter, and they have to wait to get that approval, and then go for the. It's going to be very expensive. Basically, if you get a formulary exception on your drug that they don't want to cover, you're probably going to hit that $2,100 max out of pocket because they're going to price it to where you're going to spend the $2,100. If they're going to take on something that's not on their normal formulary, they're going to make sure you pay for it. But then again, $2,100, yes, it's more money than most people want to spend, but it's not the end of the world. So for people who have expensive drugs, that $2,100 max out of pocket was a godsend. For those that just take a few basic generics, they hate it because they either got their premium raised on their plan, or they've had, or the plan they had doesn't exist anymore. They have to get a different plan. The companies turn around and say, well, we did away with this plan. Send them a letter, say, we're just continuing this plan. We're going to enroll you in this plan. And it's $50 to $100 more than you were paying on your plan. Like they send you your new card. It's got the same logo on it, but you didn't talk to your local agent and review that during the annual election period. And that's one thing I cover a lot of times with people too, and I know I'm kind of going down another rabbit hole. That is probably the most important thing we can do during the AEP. Sometimes people call it open enrollment. It's the annual election period, and that's when you review your Part D prescriptions and your Medicare Advantage plans. And yes, you should review that every year. Now, it could be just a matter of, hey, I got this letter called the ANOC, Matt, Elijah. It says they're not going to do this. Are your drugs the same as last year? Yep. Okay. Yeah. No, you're fine. You can still keep that plan, especially with the separate Part Ds. I think it's been more critical than the Advantage plans. But a lot of the Advantage plans have dropped some of their benefits. Maybe they had dental, they either cut it out or it dropped down, or they cut out the over-the-counter benefit. Like, well, where's my, oh no, your plan doesn't have that anymore. Some of the plans had food cards that don't have food cards this year. The people get upset with us and, well, why didn't you tell me? And it's like, we sent you out an email, or we sent you a letter in September saying update your information so we can review, and then you call us in January when you find out you're paying more. Not a good time. Now, the good news there is if it's a Medicare Advantage, we can still make a change for you. If you're not happy with your drug plan, you have to wait to the annual election period to change that.
Yeah, and also not just formularies, but in-network doctors change sometimes.
Yeah.
We saw a lot of that this year, especially with East Tennessee Children's Hospital. They were having a battle with one of the carriers. Thankfully, they got that sorted out.
Right.
But eventually, Dolly Parton had to step in, and now they're renaming it Dolly Parton Children's Hospital.
Yeah. That's going to make it popular.
Oh, yeah.
And every child that comes to gets a free book.
Yeah. But that's where my kids were born, to go to Nikki, my twins.
Yeah.
But, yeah, great hospital. But it made me worried. But, yeah, we see a lot of doctors switching in and out of networks. So, like Matt said, it's very important to review your doctors, whether you added or changed doctors, and your formulary, what changed in your drugs.
Yeah. And you can't, there are times you could call an 800 number or go online and find a reputable agent. But again, we still stress we think you're going to do better with somebody local. But there are other agents like myself that have very developed YouTube channels. And sometimes when I'm having my breakfast, that's when I watch them. Or I always joke because I listen to YouTubes when I'm mowing. It's like I put my headset on, and I got to pause every once in a while, take my phone out because I got to skip the stupid commercials. But there's a couple of people out there that teach Medicare, and they're doing it directed basically at people turning 65 or just people who have Medicare questions in general. I still learn things from them too, but there's a couple that I really enjoy, and I feel like we talk the same. There's one young lady, I'm not going to say names because I don't need you to go listen to them. I need you to listen to me. But there's a young lady and a young man, and they're both, I say young. They're definitely younger than me, but they're not kids. They're old. They're older than Elijah, but they're young, but they're very knowledgeable, and they present the stuff in a very easy to understand. And so it's like I wouldn't have a problem with some, if somebody went to one of them. Well, the one guy, he's not even writing Medicare anymore. He's focused on doing the education. I think his brother is still an agent, and they have other agents. They have an agency, but he's doing just the education stuff. There's another agent out there that, again, he's been in the business for like 30 years. His channel, again, it just drives to his. He has a call center, and he's very anti-Medicare Advantage, but his office does write Medicare Advantage, but they promote Medicare supplements. In fact, I've listened to a couple of his, which has affected my attitude about it. He's very strong on you should get Plan N and not Plan G. So, and says that when agents are recommending G, they're just lazy. They want to get a higher commission. It's it's the simplest to present because people who've been on Medicare for years may have a Plan F, which they just had to pay their monthly premium and didn't worry about any bills or anything. Everything, as long as Medicare's covering it, everything was 100% covered. And due to the MACRA Act of 2018, anybody on Medicare if they're new to Medicare after 2020, which is people who are turning 65 now are definitely in that boat, cannot get a Plan F. Plan G is the next best thing, and it covers everything that Plan F does except for that Part B deductible, which currently is $183. So you have to pay the first $183 of your health care, and then your Plan G picks that up. Plan N's very similar, but there's a couple of little extra costs in there, so you're still going to get some billing through the year. And I have a lot of people say, I'd rather just have it simple. I know when I do I pay my deductible and it's done. I'm not going to argue with them. They have to remember too, you're getting a plan that's more expensive. So each year when you have rate increases, that Plan G is going to go up more than that Plan N. So economically, the N is going to be a better fit for most people, but coverage-wise, people like simple. Mm-hmm. And so G is still the most popular. So we'll help you with both. We've talked about the high deductible G. I'm not going to get into that right now. We're actually coming up on the end of the show here. And so one of the things that, again, ChatGPT is great. Presented some things to come up with some taglines. I've been saying at Matt Libby Insurance, we cover you head to toe. It doesn't have to cost you an arm and a leg. But what we're going to start saying is we don't sell you insurance policies. We match you with the right plan. So until next week, we look forward to talking to you here on Insurance Matchmaking on Grace 107.7. Again, if you have questions you'd like us to present or suggestions for someone to be on the show, go to insurancematchmaking.com, and there's a comment box there, and that'll come right to us, and we can go to it. And I'm pretty sure, I don't think it asks for an email. I think you can submit it anonymously. There is information there for contact, but I don't think you have to fill that out to submit the question. You maybe do. I'd have to double check it. But please contribute. And go to YouTube. Please subscribe to Insurance Matchmaking channel, and we'll talk next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.